My role as the medical director is to bring evidence-based care into the clinic every day and to set a tone for our medical and nursing teams in how we interact with the patients and ideally in how we interact across the interdisciplinary team in our treatment team meetings. I actually practiced emergency medicine for about 15 years, and I had front row seats to the growing opioid epidemic. I was working in the city hospital in the county that had the second highest mortality from opioid overdoses in the country. The biggest misconception that I see that people have towards addiction and people who have substance use disorders is that they have chosen that route. And I wish people understood that the person that you are interacting with may not be the person that they truly are. And I wish that people understood what a big role stigma plays in how patients are perceived and how patients perceive themselves. I think it fundamentally starts with a space where people can be seen and heard as they are. They don't have to erase parts of their history that they're not proud of, where they don't have to present with an agenda that's not truly their own. I think what's really special about BHG is that it's unusually data-driven and evidence-based. Sometimes the bottom line is more important to other companies, and I've been amazed to learn that they always put the patient first. As somebody who is using the practice pathway into addiction medicine board certification, I've been very fortunate because BHG has heavily invested in my training. When I meet someone who has lost it all, they've lost their job, they've lost their spouse, and they've lost their self-respect and self-esteem. And one of the most transformative journeys that I feel that you can, be allowed to continue on is watching a patient regain those things step by step. And it's incredibly rewarding to work with patients where you see them change their habits of mind and you see them, open up a world of possibility that changes their life and their children's life and interrupts, what is sometimes generational trauma and generational inherited disease. And you can see that just passing on down through families, and that's incredibly moving and powerful.